Hi, I'm Dr. Suren Naidoo from the London Vaginal Atrophy Clinic, Harley Street. I'm going to discuss the symptoms and diagnosis of the menopause. Is it really necessary to have a blood test? Or are there easier ways to determine if you have entered the menopause? Now, if you're under the age of 40 years, you may be advised to have other blood tests and a bone density scan. Otherwise, you don't need a blood test as there are clear hormonal and physical symptoms of the menopause. So let's first look at the hormonal symptoms of the menopause. The menopause is a natural event in every woman's life, driven by major hormonal changes. Symptoms may vary between women, and some will experience symptoms for a few months, others will have symptoms for many years. Menopausal symptoms have a very negative effect on your partner, your family, and even your work colleagues. Symptoms can come and go. Some months you may be feeling completely normal, and at other times these unpleasant symptoms can affect the quality of your life. So common symptoms are hot flushes, night sweats, mood swings, tiredness and poor sleep, poor concentration. Patients may experience a lack of libido. Other symptoms such as joint pains, there may be hair and skin changes. Other psychological symptoms such as depression, anxiety, panic attacks and irritability. Some patients will present with poor memory. Some will have a worsening migraine and even premenstrual symptoms, and others may present with vaginal dryness, itching, soreness and urinary symptoms. Other patients who have had worsening premenstrual symptoms such as bloating, irritability, food cravings, lethargy, and mood swings may be due to fluctuating levels of progesterone hormone. Let's discuss hot flushes. These are the most common symptoms of the menopause and occur in and around 3 out of 4 women. They usually come on very suddenly and spread throughout the body, neck, chest, and face. They can vary from minutes to much longer. You may have associated symptoms such as dizziness, sweating, lightheadedness, and palpitations. They can occur many times throughout the day, and sometimes they may continue for many years. Hot flushes can occur spontaneously or after eating certain types of food or maybe drinking alcohol, especially wine. The next common symptom is night sweats. These are very common and troublesome. Many women will wake up several times during the night drenched with sweat, and they will need to change the bedclothes and bed linen. This can be very disruptive to the partner's sleep. The next symptom is mood swings. Not all women will have mood swings, but for other women this can be very disruptive to the home and family life. If you have suffered from premenstrual symptoms in the past, then mood swings are more likely to be a problem. We'll talk about tiredness and poor sleep. This can be related to the night sweats causing a disrupted sleep. Even if you've had a good night's sleep, you will still feel more tired than usual during the day. Another common symptom is a lack of libido. Reduced libido or sex drive occurs when your hormone levels fall, and this can be related to low testosterone levels in your body. Another common symptom is poor memory and concentration. Concentration is affected, and many women find it harder to multitask. Some women find that the brain does not feel engaged as much as it used to be, and this can affect their ability to work and function. Another troublesome symptom is heavy periods. Some women can have scanty or light periods, but others tend to have much heavier periods than normal when they reach the menopause. Psychological symptoms which may be present are such as depression, anxiety, panic attacks, and irritability. Some women find that these psychological symptoms will really affect the quality of their life. So those are the hormonal changes. Now let's look at the physical symptoms of the menopause. So let's look at joint pains. Estrogen is very important at providing lubrication for your joints and will reduce inflammation. Low levels of estrogen can lead to joints feeling aching and stiff. Let's discuss hair and skin changes. Your skin changes are due to a lack of estrogen, which is responsible for building collagen. Now, collagen is a protein that supports the structure of your skin, and low levels of estrogen can lead to skin changes. For example, reduced elasticity, dry skin, fine wrinkles, and thinning of your skin. Some women may experience itchy skin and may even have acne and facial hair growth. You also may notice that your hair tends to become thinner and less glossy. So another common symptoms patients will present with is vaginal itchiness, dryness, burning, and this is also called vaginal atrophy. Atrophic vaginitis is due to a significant decrease in estrogen levels. Estrogen is an important hormone necessary for natural lubrication of your vagina and helps to keep the area moist. Now, a lack of estrogen causes the tissues in your vagina to become thinner, drier, and inflamed. So these changes can take years to develop and will vary between women. Your vagina will shrink a little and expand less easily during sex, making intercourse painful or uncomfortable. Your vulva may become thin, dry, and itchy, and you may find you have more frequent episodes of thrush. The low levels of estrogen cause your bladder to become thinner and less elastic. This can lead to symptoms of recurrent urinary tract infections or cystitis, and you may want to pass urine more frequently. These physical symptoms of the menopause can be present long after the menopause and will affect the vast majority of women. Women usually try using topical estrogen creams, maybe using vaginal tablets or rings containing estrogen, but these treatments don't cure the symptoms of vaginal atrophy. Using topical estrogens is not the same as taking HRT and does not have the same risks of taking HRT, but has to be used indefinitely. We now have newer technologies like the Mona Lisa touch laser treatment, which has changed the lives of patients suffering from symptoms of vaginal atrophy. This is a simple procedure that is painless and delivers immediate and lasting relief. The procedure is clinically proven to work. It is performed in an outpatient setting, requires no anesthetic, has minimal side effects, and is a well-established treatment since 2012. Those are the major symptoms that are caused by hormonal and physical symptoms of the menopause. So what issues are you experiencing and what do you want to resolve right now? Let me know in the comments area below. I really want to help you get these problems sorted and to help you with your menopausal symptoms. To get more tips each week, make sure to subscribe and also click the notification bell to be notified when we upload videos to help you overcome the problems with the menopause. Bye for now.